The main goal of the 2010 healthcare law is to bring health insurance coverage to Americans who lack it. Yet two of the measure's key ways of doing this have hit obstacles. Louise Radnofsky is in Washington. She knows all about the healthcare law and the problems it's facing. Louise, good morning.
Good morning.
Okay, first problem that we should discuss. States are sitting out an expansion of Medicaid. Why is that important?
Well, the Supreme Court decision effectively gave states the choice of whether to participate in the Medicaid expansion. It's a major part of the efforts of the health law to extend coverage to millions of Americans. And what we're seeing now, a few months before the main provisions of the law roll out, is that a number of states, many more in fact perhaps than people thought at the outset, are not going to participate, at least in the first year. The reasons for this vary, but even in some cases like Florida, where the governor, Republican Rick Scott, has said that he's changed his mind. He thinks it's a good idea for the states to do. He can't persuade the state legislature at this point to go along with him. Okay, another problem, some states are refusing to set up healthcare exchanges. What are those and why are they refusing? Well, the healthcare exchanges are basically marketplaces online, but also with some analogs offline, where people can shop for policies, apply for federal subsidies towards the cost of premiums. There will be, the federal government says, an exchange in every state. It'll be running those exchanges for 33 states, and that's a difficulty for Washington because they've had to find the funds to do that. They've had to cobble together, and it's not an easy thing to do. And the way the law was set up, a lot of the funding is aimed at states that are running their own exchanges. So getting funds to those states for in-person consumer assistance, for example, has been really difficult. The net result is that there's a $54 million pot for these people called navigators, the in-person consumer assistance. But when that's spread across 33 states, it gets pretty thin. So one example we have in the story, $2.2 million are going to Ohio. Ohio has 1.5 million uninsured people. And to be clear, so you have 33 states that are not setting up their own healthcare exchanges, but the federal government will set up exchanges in those states for their residents. They will, yes. Okay. The federal government is scrambling to do that. Is it just a matter of time before states decide to expand Medicaid, decide to set up their own exchanges? What do you think? That's a really good question. There are certainly some states that don't look like they're going to expand next year, mostly because the state legislative session just hasn't been able to get it done. And those states could be, of course, the ones you'd look at most closely as the most likely to expand next year or thereafter. But at the same time, the clock is ticking for this one. States get a really good deal if they sign up in the calendar years 2014, 15, or 16. And after that, the deal starts to become less good. So there's a lot of salesmanship here. Okay, another issue that could crop up, technology hiccups. Is that going to be a problem? Well, the federal government says that it's racing to make sure that it isn't going to be a problem, but what lawmakers and consultants have also pointed out is that any big program rollout involves glitches, especially when it involves IT, and this is a really complicated thing that they're trying to do. It involves various data sets across the federal government talking to each other. The president actually acknowledged this yesterday. He said there will be some glitches and some bumps. It's not clear if he was specifically talking about computer systems, but anyone who remembers the rollout of Medicare Part D understands that there can be some technical flaws that need quick fixes in the early days, and those are the days when everyone's watching. And to be clear, Medicare Part D was far less complex than the Affordable Care Act. It was. It's an interesting comparison because it's certainly something big that the federal government has done. At the same time, it was extending a benefit to millions of people who are already in the system. This is trying to get some of the hardest to reach Americans to sign up for health insurance. And the health insurance benefit itself is also a little bit more complicated. Okay, Louise Radnofsky in Washington, thanks so much for coming on this morning. Thank you.